It's a dull, achy pain. Is the pain radiating? No. Has this ever happened before? A few times. Did it just happen? Is it on acute onset, or has it been going on for a while? This just happened about 10 minutes ago at practice. What's your level of pain? It's a 6 or a 7. What type of training have you been doing? Sprinting or running? Have there been any changes in the surface? No. Are you on any medications? No. Are there any restrictions or limitations? It hurts when I run. Did you feel any popping or snapping? No. Any locking, catching, or giving out? No. Guys in the background, pay attention over here. So, saying out loud, I'm observing bilaterally. We know that his left ankle hurts. We're looking at the right and the left sides. We're looking for any swelling, discoloration, deformities, redness, bleeding. We're looking at their posture. I walked in, walk in. He was limping. There are no scars. We're looking for any bruising. Ecchymosis means bruising, so you guys know that. So you're looking for bruising, and you're looking at the shape of his arch. Does he have flat arches? Does he have high arches? Or are they in neutral position? So then we'll start our palpation. So since his left side hurts, we're going to start on the right side, okay? What I like to do, just to keep it systematic, is start on the medial side, move lateral, and then go from distal to proximal. So we're just going to feel that medial side, feeling the bony anatomy, okay? Moving towards the back of the foot, feeling the arches, feeling the top of the foot, all of the bones and soft tissue. When we're palpating, we're using our fingers, not our thumbs. Okay, I'm going to feel that calf. While I'm down here, it's easy to just do a bump test. Okay, I'm going to feel the bottom of the foot, musculature, anatomy, bony anatomy. Feel the arches. Okay, feel the medial ligamentous, lateral ligaments. We're on the lateral medial malleolus. We can do a tap test right here. Okay? Palpating up that bony anatomy. Feeling the anterior musculature. Posteriorly. Triceps serrae group. From here, since we're here, we can do a squeeze test. That's palpation. It's that simple. So next thing we're doing range of motion, passive range of motion. We just have 4 directions that we're doing our range of motion in. So pretend I've been doing both of these, good and bad side. Passive range of motion, I'm going to take them into dorsiflexion, take them into end range. Okay, so I'm taking them into end range, dorsiflexion, try and relax for me. End range, plantar flexion, end range inversion. Oh, you have lots of inversion. You have an ankle injury? And then end range eversion. Okay? That's it for passive range of motion. Now we have our patient do it actively. We can do.
What about his toes?
We don't have to do range of motion in the toes, just the ankle.
Why not?
Because that's what this test is on.
What happens if he his toes?
Well, then we could do toes. So if we want to test the toes, we check the big toe, and then we can check the rest of the toes. Okay? And then we can do resisted range of motion stuff with the toes as well. If there was any dermatomal issues, then I would probably check the toes. So now we have our patient do active. They can do both sides at the same time. So go ahead and bring your toes up towards your head. So keep your legs down here. I want you to move the ankles, bring your toes all the way up. There we go, good. Now point your toes towards the ground. Okay, good. Soles of your feet towards the inside. So start like this. So bring the inside of your foot in.
I don't know.
Okay, so relax. So when I do it, this is what it feels like. Now your turn. There you go. On both sides. Okay, now soles of your feet out. Okay. So when I do it, it goes out like that. There we go, other side. Okay, so those are our 4 active ranges of motion. So now we're going to do our resistant ranges of motion. You have to give your patient good instructions when you're doing resistant ranges of motion. So I'm going to put my hand where I want them to push. So if I want him to bring the top of his foot up, I'm going to put my hand there. So So push up against my hand. All the way up, all the way up, all the way up. We're gonna give him to end range. Once he gets to end range, hold it there. Don't let me push you down. 1, 2, 3, 4, 5. Good. So now you're going to push down like you're driving a car. Push, 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 push. Good. Hold it there. 1, 2, 3, 4, 5. And then out against my hand. All the way. Good. Hold. 1, 2, 3, 4, 5. Perfect. And then finally in against my hand. Good. Hold. 1, 2, 3, 4, 5. So we're checking for any muscle weaknesses or imbalances there with that resistant ranges of motion.
What?
Are you gonna have the paper while we're doing the final?
You guys will not have the paper. What's your language? Okay, so when we're checking our dermatomes, you're gonna have your patient close your eyes. Close your eyes. So we have those 3 dermatomes that we're feeling. We're just gonna compare bilaterally. So feel the same on both sides. Feel the same on both sides. Same on both sides. Okay? So next thing we'll be doing is checking our capillary refill. You're just going to squeeze that toenail, wait for the blood to come back into the nail bed. We're going to check our dorsal pedal pulse. That's going to be right above the second metatarsal. Just make sure they have a pulse. Okay, good. Nice and strong. And then we do our stress test. So our first test, we're testing the ATFL. Remember our anterior talofibular ligament. We're testing, we're looking for any gapping, we're feeling for infield, we're looking for pain, okay? So, patients in this position, you're going to have their foot on your forearm, grasp the calcaneus. You're going to hold the distal leg,